thrombophlebitis, and phlebothrombosis. With thrombophlebitis, thrombo or thrombus refers to a blood clot. Phleb refers to a vein, and itis refers to inflammation. So thrombophlebitis is a blood clot that gets lodged in a vein and causes inflammation. The process starts with damage to the endothelium, or the inner lining of a blood vessel's walls. After this, there's an immediate vasoconstriction, or narrowing of the blood vessel, which limits blood flow. After that, some platelets adhere to the damaged vessel wall and become activated by collagen and tissue factor, which are proteins that are normally kept separated from the blood by an intact endothelium. These platelets then recruit additional platelets to form a plug. The formation of the platelet plug is called primary hemostasis. Next, the coagulation cascade is activated, which activates the protein fibrinogen to fibrin, which then deposits and polymerizes to form a mesh around the platelets. This makes up the process called secondary hemostasis, and they result in a hard clot at the site of the injury. As the clot grows in size, it limits the amount of blood able to pass through the vein, and pressure in the vein increases. Usually, the blood clot starts naturally breaking down. But in thrombophlebitis, it doesn't break down and causes inflammation. Thrombophlebitis is most common in limbs, and it usually occurs in the lower leg. It can make the area around the clot inflamed, and this causes pain, swelling, redness, and warmth. Superficial thrombophlebitis can cause the affected vein to become hard, like an electrical cord. Septic thrombophlebitis can also cause systemic symptoms, like fevers. If the septic thrombophlebitis is severe enough, it can lead to shock, where there's a drop in blood pressure, and organs can fail from not getting enough blood. And some small clots resolve on their own over time. However, large clots that cause symptoms typically need an intervention. Thrombolytic enzymes can be given to help break down the clot, or a thrombectomy can be done to surgically remove the clot. Long-term treatment to prevent future thrombi from forming can include anticoagulant medications like warfarin or heparin. which inhibit the clotting cascade and prevent clot formation. Prevention of a deep vein thrombosis is also important. Compression stockings and frequent calf exercises. During long periods of sitting still, can help move blood to the veins to prevent stasis. Deep vein thrombosis. Deep vein refers to the veins that typically run between muscles as they travel back towards the heart, as opposed to superficial veins that you can see on the surface, and thrombosis refers to a blood clot. So a deep vein thrombosis, or DVT, is a blood clot in one of those deep veins. Normally, blood makes it back to the heart from the tissues and organs via a network of veins that merge over and over. Superficial veins drain blood into deep veins, which rely on the skeletal muscle pump to move blood forward. The way it works is that the surrounding skeletal muscles compress the vein and propel blood forward, and the vein prevents blood from moving backwards by using one-way valves. Ultimately, all of the blood ends up in the superior or inferior vena cava and then dumps into the right atrium. From there, the blood goes into the right ventricle and before being pumped into the pulmonary artery and eventually into the lungs. Deep vein thrombosis most commonly develops in the lower legs, below the knee, although blood clots can form in both superficial and deep veins, and in other parts of the body as well. There are three main factors that lead to a deep vein thrombosis, which are collectively referred to as varicose triad. The first factor is slowed blood flow, called stasis, in the veins. Typically, blood flows in a continuous smooth stream to the blood vessels. If the blood flow becomes turbulent, the linear flow is disrupted, and slow or static pockets of blood are formed. Stasis can also occur during long periods of inactivity of the skeletal muscle pump, such as with bed rest, long flights, and car rides, or even during pregnancy when a growing baby compresses nearby veins. The second factor is the state of hypercoagulation, where altered amounts of clotting factors increase primary or secondary hemostasis. This can occur for genetic reasons, acquired reasons like surgery, or simply for taking certain medications like birth control pills. During surgery, physical damage to vessels activates the clotting cascade. Birth control pills tip the blood's balance towards clotting because they increase the levels of clotting factors and decrease the levels of some anticoagulation factors like protein S and antithrombin. A third factor is damage to the endothelial cell lining of blood vessel that expose tissue factor and collagen. Damage can be caused by infection, chronic inflammation, or toxins like those found in tobacco cigarettes. Diagnosis of a deep vein thrombosis can be made by ultrasound. Alternatively, if the ultrasound is inconclusive, a more invasive venography procedure can be performed. This is when a dye is injected into the veins and an X-ray is taken to identify blockages. Also, a D-dimer blood test can be helpful because fibrin breakdown product levels are usually higher in the presence of clot. A deep vein thrombosis is most common in a limb. Usually, the lower leg below the knee, and it can make the area around the clot inflamed, causing pain, swelling, redness, and warmth. If a pulmonary embolism occurs, it can cause sudden shortness of breath and chest pain. And depending on the amount of lung tissue affected, it can be fatal. Anticoagulant therapy, or the administration of a medication to delay the clotting time of blood, prevents the formation of a thrombus in postoperative patients and forestall the extension of a thrombus after it has formed, or dissolve a thrombus that has already formed. If the patient is receiving anticoagulant therapy, the nurse must frequently monitor prothrombin time, hemoglobin and hematocrit values, platelet count, and fibrinogen level, or prevent an inadvertent infusion of large volumes of heparin, which could cause hemorrhage. Continuous intravenous infusion by electronic infusion device is the preferred method of administering unfractionated heparin. If bleeding occurs, it must be reported immediately, and anticoagulant therapy must be discontinued. Bleeding from the kidneys is detected by microscopic examination of the urine, and is often the first sign of anticoagulant toxicity from excessive dosage. Bruises, nosebleeds, and bleeding gums are also early signs. The use of elastic compression stockings improve blood flow and also reduce swelling and pain, and pressure stops blood from pooling and clotting. The use of intermittent pneumatic compression devices and increases blood flow through the veins of your legs and helps prevent blood clots.